The final video that we're going to be looking at in this short collection of videos is looking at fibroblasts. Fibroblasts are the major cellular component of the dermis. They have all of the complexity of cells anywhere else in the body. They have been regarded as rather boring cells, but in fact fibroblasts are extremely interesting. They produce matrix, collagen and elastin. They degrade matrix. They're responsible for the turnover of the matrix in connective tissues. They produce bioactive factors. They're very gregarious. They communicate with the immune cells. They interact with neural cells. They interact with the vasculature. They interact with the keratinocytes in the epidermis. So the fibroblast is more than just a very humble worker cell. It is a key cell in the maintenance of the dermis. This role comes out when the skin undergoes an injury and there is a wound where there is injury to the dermis and some bleeding occurs. At the site of the damage to the blood vessels, there will be platelet aggregation, adhesion, degranulation, clot formation, and the degranulating platelets will recruit polymorphonuclear leukocytes to the site of injury. They will line up along the inside of the capillaries and squeeze through the gaps between the endothelial vessels into the tissues. They begin an initial assessment of the injury. They will undertake some preliminary phagocytosis, and in the process of that they die, and we see that as pus. But before they die, they're releasing cytokines, and one of the primary functions of those cytokine releases are to activate macrophages. The macrophages are more complex cells. They undertake a higher order of assessment of the damage, and they begin to control the process of repair. Now, for repair, you need the fibroblasts. The fibroblasts are going to be recruited to come into the site of injury to begin to produce new matrix for repair. There will also be recruitment of endothelial cells to lay down a new network of capillaries, and we see those immature capillaries and matrix material in granulation tissue. As the process of wound healing proceeds, there will be remodeling of the newly laid down matrix, and that remodeling will carry on for months, sometimes years. And the end result is going to be scar tissue. Scar tissue is characterized by an abnormal matrix architecture when compared to the uninjured tissue. So we have normal scar, we have pathological scars, hypertrophic scars, keloid scars, and fibroblast activity or dysfunctional fibroblast activity is involved in these abnormal forms of scarring. One thing to mention about fetal wound healing, which is of particular interest in this context, is that fetal wounds were observed to heal without scarring, but we were able to establish that collagen deposition did occur in the fetal wound. It's the question of the organization of the collagen that is the key determinant of the quality of the repair. In the fetal wound in the second trimester, there are no activated macrophages coming in to speed up the process, and it is the role of the activated macrophage that is primarily responsible for scarring in the postnatal wound. Fibroblasts, like keratinocytes, can be cultured in the laboratory, and there are many uses that have been made of cultured fibroblasts. One of the most interesting is the incorporation of cultured fibroblasts within a dermal matrix in a commercially constructed skin substitute ampligraph. So there are some MCQs to finish off this video.